A government white paper on social care was released this week, promising to spend more than £5 billion over 3 years. Boris Johnson's vowed to end the often crippling bills faced by many in old age, announcing a cap on care costs for adults in England from October 2023. So what could this mean for the social care sector? The chief executive of the Four Seasons Healthcare Group, Jeremy Richardson, is with us. Good morning, Mr. Richardson. How worried is the care sector about facing a winter crisis with Omicron and everything else?
Morning, Trevor. I think the sector is really worried at the moment, not necessarily because of the threat faced by Omicron, but because of the bigger challenges, the wider issues that we've got, which are long-term and not just in the moment.
So you think that there could well be a winter crisis as bad as it was last winter?
Well, look, I don't think the sector is going to collapse tomorrow, but it's gradually falling over. And the problem is that incrementally, you're seeing a decline in the quality of services. So if we look at the social care reform that's just been announced, I applaud the intent that the government has undertaken because they are the first government in many decades to try to tackle the problem. The issue is that the execution is really disappointing. Somebody last week described it as an underpowered saloon car when what's required is a Formula One racing car, and I think that's probably quite apt.
I want to come to the social care reforms in a second, but before we do that, can I just ask you about the impact of the government's mandate that all staff should be jabbed? I know that you and some of your colleagues were concerned that this would have an impact on staff numbers. What do you know so far?
Well, look, I've been really clear, and I've said I didn't think that mandating the vaccine was the right thing to do, and I still think that that's the case. But unfortunately, that ship has now sailed. We have lost about 200 staff members, so that's 200 really hard-working members of team who are providing care to our residents on a day-to-day basis.
If I may ask?
200 people we think have left the business. So 49 people left on the 11th of November. So those are the people that we had to dismiss. But then you've got to take
total of what number? What is your workforce?
So we have 12,500 team members, 49 left on the final day, but we estimate that 200 left in the run-up. So in total, we've lost about 1.6% of our workforce. And what you've got to bear in mind is that at the time that we had to get rid of those people, we already had 95% of our team fully vaccinated, double jabbed, providing protection to themselves and also to the residents. So I think in a situation like that, what you have to do is weigh up relative risk. And the greater risk to my residents today is that I don't have enough team members to look after them and provide really good quality care than the risk presented by transmission of the virus itself.
So let's talk about the social care reform to see whether what the government's brought forward might help to deal with that risk. From what you said earlier on, you don't think much of it. It clearly didn't meet your expectations.
Well, no. I mean, as I say, I applaud the intent. So the Prime Minister has stood up and he's told the public that the social care issues are going to be solved. And if you're a member of the public, then you rightly believe that the problem has been solved because that's what the Prime Minister has told you. The problem is that all that's been announced is a short-term funding plan for the NHS. So £36 billion is going to be raised over the next 3 years. 31.6 billion of that is going into the NHS. So only 5.4 billion is going into social care. That's 1.8 billion a year. And it's widely accepted by all experts that the sector needs between 7 to 10 billion a year just to stand still. So unfortunately, if you're going to announce that you're fixing social care, don't just fund the NHS. There isn't enough funding going into the sector. That's one of the problems. And the second issue is that it's not tackling today's issues. The money that we are going to receive in the bulk is coming in 3 years' time, and that's assuming that the NHS choose to hand it back over at that stage.
If I may, when I spoke to Mr. Sunak some weeks ago about this, his argument was that you couldn't spend that money tomorrow, and what you needed to do was to build it up so that in 3 years' time, you're getting the bulk of it, and that over time, that number would build up. Did you accept that argument?
No, of course I don't. I mean, that's a really convenient thing for him to say because it allows him to justify not putting the funding into social care today that it really needs. So no, I absolutely disagree with that. That the fundamental issue here is that the true cost of care, so what it costs to look after people safely and to provide them with a really good quality of life, is not provided by the local authorities. So if additional funding came into the sector now, what you would see is an increase in the average weekly fee provided by local authorities. And I absolutely could spend that money, because the first thing I'd do is I'd start to pay the team who are working so hard in our homes what they're really worth. At the moment, it's very difficult for us to do that because our revenues are capped by local authorities, which in turn are capped by the lack of funding provided by central government.
I mean, all round, it sounds like you are really rather despairing both of the current situation and also the impact of the government's plans as published in their white paper.
Well, look, I'm not despairing, because we are very fortunate, both as a company and as a country, that we have so many phenomenally hardworking people in social care. I'm despairing, but then I am despairing in the context of the finances, because I don't think we've solved the issues, and we will simply continue to see a deterioration and gradual erosion, if we're not careful, of the services that we're able to deliver to people. And I think we have to ask ourselves as a country, what is it that's important to us? Do we want to give our elderly people dignity and quality of life in their old age, or do we want to simply ignore them? And I think the risk is that unless we put proper funding into the sector, unless we really grapple with the issue, then we're just going to see a slow deterioration of the quality of service we provide. And I don't think that's morally right. I think we owe it to our elderly people to provide the best quality of care that we possibly can.
Thank you very much indeed for your time this morning, Mr. Richardson.
Thank you very much.